Hi everyone, welcome back to my YouTube channel. I hope you are well today and I hope you are taking good care of your health. If you are new, welcome. My name is Regina Mother. Please join the family by clicking the subscription button. So today I'm going to talk about GERD, G-E-R-D, gastroesophageal reflux disease, or acid reflux, or acid regurgitation. It is a condition in which the content of the stomach reflux back to the esophagus and then cause the irritation of the esophagus. Usually, there is sphincter, lower esophagus sphincter, between the esophagus, which is the food pipe, and the stomach. So when we are eating or swallowing something, this sphincter contracts, like this sphincter relax and allow the passage of food. So after the passage of food, the sphincter will close back. Like if this is the esophagus, the sphincter will be like this. It controls the opening of the esophagus to the stomach. So while swallowing, it will relax so that food will pass, and after the swallowing, it closes back and prevents the coming back or reflux of the stomach content back to the esophagus. That is the normal physiology of the body. But in GERD, this sphincter, which is guarding the esophagus and stomach, will now relax even without swallowing. So when the relaxation occurs without swallowing anything, then the content of the stomach will reflux back to the esophagus, and this causes irritation, resulting in symptoms of GERD. So this do happen occasionally. It is not a cause for concern, but when it occurs more than 2-3 times in a week, then it is a cause for concern. Because if it happens more regularly, then the content of the stomach, which is made up of acid and digestive enzyme, will irritate the lining of the esophagus, and that will cause ulceration or other condition. The symptoms of GERD is heartburn. Like it is usually characterized by heartburn when you have constant burning sensation in the chest, and this pain will radiate towards the neck when you have to feel lump sensation in your throat. Okay, so it will feel like you finish eating, but the food have not passed to the stomach properly. It seems the food is just moving through your chest up and down. So that is lump sensation. And then it's also characterized by bitter taste at the back of the throat and difficulty swallowing sometimes. Though initially this will not be involved. It's only when there is ulceration in the esophagus, that is when there will be difficulty swallowing. Then regurgitation, like you finish, we all know that it's only ruminant animals that do cold chewing, like regurgitate food which they have eaten and then start chewing it back. But when you have this condition, this GERD, after eating, maybe within few minutes, then you belch, like you release gas through your mouth. The content of the stomach will come out also, like you feel food particle in your mouth when you belch. This is also symptoms of GERD. And then indigestion and bloating sometimes. So these are the symptoms of GERD. So the symptoms of this GERD usually happen after eating, and it gets worsened when you lie down. Okay, it will be worse, and also it do happen at night most of the time. So what are the causes? There is no specific cause, but there are risk factors. That is things that are likely to cause it. Okay, so number one is being obese. Being obese, if your weight is too much. Number two is being pregnant. This happens because when the fetus is growing in the womb, it will compress other organs, and then it will also push the stomach to come up, and then to come up, creating pressure that can cause the relaxation of the sphincter, and then heartburn might occur. So it do happen in pregnancy, but in that case, once the baby is delivered, the person become normal. And that thing is hiatal hernia, in which the structure of the esophagus is not properly formed. then connective tissue disorder like scleroderma. So these are the risk factor. Another minor things are overeating. Like if you're someone like me who likes to eat so much and then allow your stomach to be so full, or the habit of lying down immediately after eating or just few minutes after eating, then eating so much spicy food and drinking caffeinated drink and other soda drinks, eating deep fried food. Smoking is also involved. That is the abusers. There are different stages. There are 3 stages of GERDs. Stage 1 is mild. It's not a cause for concern. Maybe the symptoms or the episode will occur less than 2 or 3 times in a week. The stage 2 is moderate to severe. In stage 2, it's moderate to severe. The occurrence of the symptoms is more than 3 times in a week. And then in stage 3, that is chronic, these symptoms will happen every day and there will be ulceration of the esophagus. The lining of the esophagus will be eroded and that will result in the ulceration. So now I will talk about the diagnosis. Though GERD is usually self-diagnosed, but if you are not sure and go to the doctor, they will diagnose you by physical process and also by asking you few questions. The diagnostic method of acid reflux are: number 1, barium swallowing and X-ray. In this, they will make you to drink barium and then conduct X-ray on your chest to see if the lower esophagus sphincter is loosened. The next diagnostic method is upper endoscopy, in which a flexible tube attached with tiny camera is inserted into your esophagus and then observe the esophagus to see if acid reflux back and also if the sphincter is loosened up. The next thing is esophageal manometry. In this, a flexible tube also is inserted and then the strength of the esophagus is examined. The next diagnostic method is esophageal pH monitoring, in which a monitor is inserted into the esophagus and then observe if and when acid from the stomach reflux back to the esophagus. So these are the diagnostic methods. Now we'll talk about the complications. That is, if this GERD is not treated, what it will lead to. Number 1 is esophagitis. That is inflammation of the esophagus, where there will be constant burning of the esophagus, like burning sensation of the esophagus. Number 2 is esophageal stricture. That is narrowing of the esophageal lumen. This results in difficulty swallowing, dysphagia. Next thing is Barrett esophagus. In this, there will be damage, like complete damage of the lining of the esophagus, and that can lead to esophagus cancer. And then the last thing is respiratory disease, like asthma and constant cough, because whenever this refluxation occurs, there is possibility that the content of the stomach, which has been refluxed back to the esophagus, will enter into the respiratory tract, like the trachea, and that will irritate the trachea and the lungs, resulting in asthma or constant cough. So these are the complications of gastroesophageal reflux disease. So what are the treatments? The medicine given are antacid. This will help to neutralize the acid made by the stomach, so that even if refluxation occurs, the lining of the esophagus will not be eroded or get irritated by the acid. Examples are Gelosi, Malos, Pepto-Bismol, and other antacids. These are found over the counter. You can easily walk into the pharmacy and get these medications. So this drug acts quickly, like it acts very fast. If your symptoms is severe that you need immediate relief, antacid is an option because it acts very fast, though the action does not last for a long time. The next drug is H blocker. This drug like cimetidine, famotidine, nizatidine. This drug will block the release of acid into the stomach. It doesn't act fast, but the action lasts longer. Some people do make this mistake buying H2 blockers like cimetidine and then combine it with antacid. You should not make this mistake at all because these two drugs doesn't go together. You should never ever mix these two drugs together. The next drug is proton pump inhibitors like omeprazole, rabeprazole, pantoprazole. This drug will completely block the synthesis of acid in the stomach for a while. The action lasts longer than H2 blockers. The side effects of this drug, like the antacid, is constipation or diarrhea, depending on how frequently you are taking the drugs. And then for H2 blockers and proton pump inhibitors, the side effects are headache, nausea, vomiting. Another treatment will be behavioral changes. Like if you are the type of person that do feel tired and like to sleep immediately after eating, you should try to stop it. If you are the type like me that like to overfeed, like feel like eating the whole food in the pot, then you have to minimize the quantity of food you eat. Reduce it. Because even if you are taking treatment and you are eating much and practicing this bad habit of lying down immediately after eating, the drug might not be that effective because constantly you are exposing your body and make the sphincter to open each time, and then the content of the stomach reflux back to the esophagus, irritating it often and often. The first drugs I mentioned, that is antacid, you can get it over the counter. If your symptoms or your condition is not serious, then you can easily walk into the pharmacy and get antacid and take with the advice of the pharmacist. But if you have severe symptoms, then don't even try to treat yourself. Work with a doctor or any healthcare practitioner. If you don't have access to hospital for diagnosis, make sure you take your treatment or your drugs under the guidance of healthcare provider. Don't practice self-medication, as I always say. If you observe that you have GERD and you overfeed, you eat spicy food, you eat deep fried food, and also you do lie down immediately after eating, try to stop these things first for like 1 month to 3 months. If the symptoms is not relieved, then you can engage yourself in medication, because sometimes all this habit will result in it, and first you might even jump into treatment which might not be needed. This GERD or acid reflux is not only in adults, it also happens in babies. Babies do have it. Like some people do have this constant belching and vomiting and spitting food. So, but if it occur more frequently, with these symptoms like irritability while eating or after eating, sleeplessness, difficulty swallowing, difficulty sleeping, reoccurrence of pneumonia or cough, weight loss or poor growth, wet bumping, like when the baby belch, they must bring out food, or constant hiccup all the time, then sleeplessness, refusal to eat. Along with this, then you try to observe your child properly and then take him or her to a pediatric doctor for treatment. If you observe these things in a baby and then think that your baby have acid reflux, don't even try to treat him or her by yourself. Make sure you contact a healthcare provider, especially a pediatric doctor, for them to treat your babies. Don't practice self-medication or buy any over-the-counter medication for your baby. That is the end of today's topic. I hope you enjoyed this video. Please, if you do, give me a thumbs up. Subscribe to my channel, comment, and share to your friends. And also, if you know about this disease based on the symptoms and the description, if you know the name in native language, especially Nigerian language, Igbo, any language, please comment. And also, if you have any traditional treatment or cure, please also comment in the comment section below, because me, I don't know what it's called or if it have any herbal or traditional treatment. But if you do, with an evidence, please don't hesitate to comment on the comment section below so that we all will know. Thank you for watching, and do take care of yourself and have a good day. Bye bye.